Shadow Health Minister Mark Butler is speaking about the vaccine rollout.
19 vaccine. But here in Australia, only 164,000 Australians have received the COVID vaccine. Well over 99% of the Australian population is still to receive even their first dose of the COVID vaccine. Now, I've said many times before, the Prime Minister promised that 4 million vaccines would have been delivered by the end of this month, a target that they long ago decided to slip into April, then into the end of April, and have now dropped altogether. I've seen other targets denounced over the last little while, a target of 6 million vaccines by the 10th of May and perhaps as many as 11 million by the end of May. I think 6 million by the 10th of May, 11 million by the end of May. But what we've seen this morning is that the systems to deliver this strategy are remarkably still not in place. We've seen from the College of General Practitioners, their president, Dr Karen Price, remarks this morning, just reflecting again what I've said, that the national booking system, the way in which Australians book their vaccine, is still being built. We've known for months that we would need a national booking system, and still, if you look at the Department of Health website, it is still being built. Dr Price described the national booking system this morning as a little bit of a mystery. Well, more than 6 million Australians are due to be able to book their vaccines from next week without a national booking system. Without a national booking system, this is utterly remarkable and irresponsible. Also, we've seen, not just from Dr Price but other GPs this morning as well, a complete lack of certainty about how many doses GP practices will be delivered next week to start that new phase, the over 70-year-olds and others as well in the population. GPs have no idea whether they will be provided doses next week. They're being inundated by phone calls to their receptionists asking whether their patients can book with them, and they're not able to provide any information whatsoever. This vaccine rollout is fast becoming a complete mess. It is way behind schedule, and the systems that we need in place are still remarkably still being built. At the same time, though, the government is quick to pull out JobKeeper, losing as many as 250,000 jobs, we heard this morning, while the vaccine rollout strategy that is intended to undermine confidence in the economic recovery is way behind schedule. Quick to pull the economic supports, way too slow, a snail's pace vaccine rollout. Can I also say that this morning we've again seen divisions within the coalition about the fundamentals of this vaccine rollout. The Deputy Leader of the National Party in the Senate, Senator Canavan, has made some deeply irresponsible comments that directly undermine the authority and the integrity of the Therapeutic Goods Administration, one of the best regulators of medicines and other therapeutic goods in the world. Remarkably, I've seen nothing from the Prime Minister, nothing from the Minister of Health to countermand those deeply irresponsible comments from Senator Canavan. But I can say on behalf of Labor that we have full confidence in the ability of the Therapeutic Goods Administration to monitor any adverse events information from around the world and to provide appropriate information to the Australian community and to the Australian government. These comments from Senator Canavan are dangerous, they are divisive, and they further undermine a vaccine rollout that is already way behind schedule. Happy to take questions. Well, we have full confidence in the TGA's ability to monitor any adverse events information for any of the vaccines that will be delivered here in Australia and to provide appropriate information to the Australian government and, most importantly, to the Australian community. And we'll listen to the advice of the TGA and our public health experts.
Do you think that, given that in Australia, as a whole, we don't really have a huge risk of COVID at the moment, given our cases are so low, do you really think that speed is paramount here, given we don't have those sorts of concerns? Why not just, slow it down a bit, make sure that all the processes are in place and that we're actually doing it safely rather than doing it as fast as possible?
Well, look, we supported a full consideration of all information for the TGA to approve these vaccines, but we've said once they're approved by the TGA, vaccines should be rolled out as quickly as possible. I see bit more interest in the Deputy Prime Minister. Look, we have full confidence in the TGA. We supported a full consideration, unlike the emergency approval processes followed in some countries in the Northern Hemisphere. But now that approval has been given, it is time to get this vaccine rolled out. We know from the cases we saw just in Queensland and New South Wales this week that frontline quarantine workers and others in the community are still exposed to COVID being brought back from returned Australians and other travellers. And we know also that confidence in the economic recovery is seriously dependent upon a successful rollout of the vaccines. We've heard that from business group after business group over the last several days, complaining about the slowness of that vaccine rollout.
Papua New Guinea, there is some serious concerns about what's going on with the spike in cases there. Though Pat Conroy spoke to your party room this morning about 40% pregnant mothers in that country right now have coronavirus. What should the government be doing about Papua New Guinea, given its proximity to our doorstep?
Well, you rightly make the point. PNG, at its closest point, is only a few kilometres from Australia, up near the Torres Strait. It is in our national interest, as well as a good neighbour, that the COVID does not get a hold in PNG. Pat Conroy gave a comprehensive report to our party room this morning, and he's already called for three things to be considered by the government. First, an urgent release of PPE, personal protective equipment, particularly for frontline health workers in PNG, who are really on the front line there, but also the ability to get further testing kits available to PNG, and finally to consider a release of some vaccines to be given to frontline health workers that are most at risk, but are also the most obvious potential spreaders of infection in the general community. This is a very serious concern. Now, I've seen reports over the last few hours that the Commonwealth and the Queensland governments are in consultation about a response. I support that. It needs to happen sooner rather than later. Oh, you're all back.
That was Mark Butler there, speaking on all things vaccines. If you'd like to keep watching that news conference, you can. It continues on our Sky News Extra 2 channel.